What is endofusion? Endofusion, in short, is a new minimally invasive spine surgery, also called as endoscopic spinal fixation or endoscopic assisted spinal fusion. In this technique, the surgeon uses a tiny endoscope, a camera tip tube, a rigid tube like this, goes through a small incisions to fuse two or more vertebrae in the spine. In simple terms, endofusion lets us to stabilize, realign the spine without the big cuts of open surgery. For example, one description notes that endofusion is minimally invasive spine surgery that combines endoscopic visualization with spine fusion to stabilize and decompress the affected segments. In short, endofusion is a type of spinal fusion done with endoscope and tiny instruments aiming for the same stability as traditional fusion but through a much smaller opening, reducing the collateral damage. How is it different from traditional spine surgery? In a traditional open fusion, the surgeon makes one long incision and must cut or move aside large muscles and tissues to reach the spine. This causes more bleeding, muscle trauma, and a longer recovery. By contrast, endofusion uses one or more tiny incisions, often less than 1 centimeter each. Through this incision, we put a screws and an endoscope is inserted, and the camera sends live images to the monitor so the surgeon can see the spine interior without a large opening. Specialized instruments are passed through this tube to remove the herniated disc pieces and bone spurs pressing on the nerves and prepare the space between the vertebrae. Because the muscles and bones are disturbed much less, tissue damage is greatly reduced, resulting in less pain and faster healing. In short, spinal fusion is achieved without disruption of the body. As a result of which, recovery is quicker, faster, muscle trauma is less blood loss and least nerve damage. Who is eligible for endofusion? Endofusion is aimed at patients whose spine problems need fusion for stability. Typical candidates include people with degenerative spine conditions, for example, patients with degenerative disc disease, spondylolisthesis, what we call it as slipped vertebrae, spinal stenosis, or certain fractures may be considered. Doctors usually suggest endofusion when conservative treatments like physical therapy, medication, pain management haven't helped enough. Candidates should be in good overall health and have a spine problem that is limited to specific level that spine surgeon can reach with small tools. In other words, a good candidate might be someone with a painful unstable disc or vertebra at 1 or 2 levels who is otherwise healthy enough to undergo surgery. How endofusion is performed? Endofusion can be done either under local anesthesia, epidural anesthesia, with spinal anesthesia, or with general anesthesia. Most of the time we do under general anesthesia. If patient is very sick or having lot of comorbidities, we do even under local anesthesia. After patient is lying down on his stomach with the back painted and draped after anesthesia, endoscope is passed to the desired level, and without damaging the muscle, the bone is drilled and the desired pathology is reached, where you remove the offending agents like disc, the ligament, the bony spurs, everything is removed, and once the disc is removed, the end plates, what we call, is prepared. We call it as bed is prepared, and the patient own bone chips are filled into the space endoscopically, and a spacer is placed through the endoscope. So this avoids muscle trauma, bone trauma, and the nerve injury. Once this is done, then any other compression onto the opposite side is also relieved. So all the pressure on the nerves is relieved. At the same time, the disc is taken care of, the spacer is placed. Once this is done, then with the tiny small holes, the screws are placed and rods are also inserted with the latest technology we have today, where we call it as minimal invasive spine fixation. Once this is done, the endofusion is completed with small tiny holes which are sutured, or sometimes a glue is applied even without sutures. The resultant outcome is comparable or better than open surgery is because you have done a less muscle trauma, no blood loss, no bone damage and no nerve injury, and the visualization is such that you have done the removal of all the offending pathology with utmost care not to injure the muscles. Recovery is faster, going home is faster, joining back to work is faster. So that's the advantage of END0FUSION.